You're not just a nurse, you're not just one other carer, you are actually a health leader, irrespective of the position you find yourself in your own agency or in the hospital or any space you work in. The global health industry represents the sum total of activities that promote industrial health production, labor markets, financial markets, and resource allocation within a country's health space and between different countries. Now, you would understand that with the increase in the migration of nurses into different countries, the governments of different countries, there are certain targets on recruitment, such as in the UK, sometime in 2019, if I'm not mistaken, they targeted getting over 50,000 more nurses from overseas for the NHS by 2024. And from the recent prediction, it is, however, obvious that they may not really they will meet these targets, but they would actually need more nurses by 2024. So nurses are part of the key professionals contributing to the growth of most countries. Nurses are the largest professional groups globally. However, nurses, especially in low and middle income countries like Nigeria, are not yet developing and implementing on focused models to measure the nursing impact, including how nursing contributes to the economy, which is why we are here talking about you positioning yourself as a leader in the global health industry. Next slide, please. Now, global health industry contributing to the global economy. How does the global health contribute to global economy, and how does nurses play a major role in this space? Now, we should know that health outcomes affect the economy of nations, and the matters of socio-economic status and population health issues are of major interest and challenge for governments and policymakers. When you look at most economies, you see them focusing more on health because it forms an important part of policymaking. Healthcare access impacts almost every human indicator. Now, think about your country now. Everything that enhances survival in your country, we have maternal and child health mortality rates, we have rates of preventable and infectious diseases, rates of communicable diseases, employability. It takes a healthy nation to have good employees and to have good employers too. We have gender equality, it's also something that relates to health, workforce productivity, trends in mortality rates, and more. The governments of most nations, however, know that without optimum health, that the health of that nation and each productivity level would be something that will not have an increase. So, what are the roles of nurses in influencing these global health indicators? When I talk of global health indicators, I'm talking of these things I've mentioned: maternity and child mortality rates, rates of preventable diseases, non-communicable diseases, employability, gender equality, workforce productivity. These are the things that makes up the economy of a nation. And now we are talking about the impact of the global health industry in this economy. Now, I want you to listen on the roles of nurses in influencing these global health indicators. Now, this is where your positioning as a leader in the global health industry will come to play. All right, next slide, please. Embracing and promoting inclusion of nurses in the global health industry is your responsibility to actually embrace leadership for inclusion in the global health space through the knowledge that I will share with you here. Now, the Nurse Mentorship Academy must have provided you with a stepping stone, a foundation to launch out. Now, my section here is giving you that idea that you're not just another nurse who is launching out, who is being developed in the space of the nursing profession. You are a leader in the healthcare space. And I'm not just looking at nursing now, I'm looking at the global health space. So, where am I? Sorry. Okay, embracing inclusion in the global health space. So, what are the things you need to do through the knowledge that you've acquired so far? One thing you should know is that global health drives global economies, just like I mentioned earlier. The role and function of nurses and nursing is linked to each and every one of the indicators I listed earlier: mortality rates, employability rates, workforce productivity. Nurses play a major role because it takes a healthy nation to be a wealthy nation when we talk about global economy. So nurses have significant capacity to positively impact health outcomes in every nation. That is the mindset you should start with while you are launching out as a mentee of the Nurse Mentorship Academy. Another thing you should understand is that human resources, uh, the government invests billions of finances and human resources into the health space. Now, increasingly, governments are looking to nurses' workforce as a means by which they will meet the increasing levels of health demand and provide more health care to its population. Now, what you should understand is WHO, for instance, will launch a program. They will look for people who work in community settings, most especially doctors, nurses, and other community healthcare workers, because they know they cannot move from wherever their headquarters is in Geneva or anywhere their headquarters is. They cannot move down to this local community, let me say in Uganda, in Zimbabwe, in Mozambique, to implement on these policies to drive the health sector in that nation. So they will need nurses to lead those initiatives, which is why you have to position yourself as a leader in the healthcare space. Another thing we should understand is that governments are looking at nursing workforce to grow its health economy. I mentioned earlier that without a good health economy, there would be no national economy. No nation will develop without its health economy. If you doubt me, look at the implication of COVID last 2 years, what it did to the economy of different nations. It therefore shows that without better health outcomes, without good health outcomes, many nations would find it difficult to progress in their own economy. Next slide, please. Now, nurses have a diverse global health workforce, which is what they should consider as a first step towards stepping up. Now, the question that is important is how can you grow your platform to become a major stakeholder contributing to the global economy? Now, my topic is you positioning yourself as a leader in the global health industry. Once you've been able to achieve that, you've achieved that positioning in the global health economy. From my narrative so far, you would know that you would go a long way positioning yourself as a leader in global economies. So how can nurses grow their platform to become major stakeholders in global economies? Next slide. Now, nurses can influence and become policymakers. This is very important. Nurses can influence and become policymakers, change agents, and maybe politicians. We can achieve this simply by strengthening our individual efforts towards meeting the UN defined 13 targets and 28 indicators for SDG 3. Now, the Nurse Mentorship Academy, for instance, is a product of the SDG. Even if you're not aware of it, SDG 3 talks about health. One of the SDGs talks about education. Now, this is where the Nurse Mentorship Academy comes to play. It is meeting to a sustainable development goal, which is what you as a mentee should target in your workspace. Go back and look at the 17 sustainable development goals. See how you can develop your work to meet any of this need. It can be you focusing on SDG 3, such as my organization, I focus on SDG 3. Then in SDG 3, there are several targets. It might be reproductive health, it might be maternal and child health. You have so many you can focus on. Once you've done this and implemented on it locally, you've started solving specific solutions to problems. All right. So each nurse finding a community need around the goals and providing targeted solutions consistently is the first step to positioning yourself as a leader in the global health industry. Now, WHO designated 2020 as the year of the nurses and midwives to acknowledge the efforts of nurses in global health space. This shows you that nurses serve as important members of the global health space. They are not just meant to occupy the bedside, they are also meant to occupy boardrooms. They are also meant to be community leaders. Nurses are also meant to be research experts and brand ambassadors. So if you're graduating as a mentee from this program and you're limiting yourself that you're just the other nurse who want to count, this is the time for you to stop imagining yourself in that light and start looking at yourself as that community leader who brings about change in his or her community, that board leader in health institutions, that research expert, that brand ambassador, that voice to which other nurses behind you would look up to. Now, about 20 years ago, the concept of global health was not well established, but over the years, global health has been one thing most nations have keyed into in developing their own economy. Global health is an important aspect of public health policy and governance. We cannot separate global health from governance. So, global health is very, very important when it comes to governance. Every policy of every government is around healthcare because they know that a healthy nation definitely is a wealthy nation. You can imagine the strength of governance in the UK without mentioning the NHS. If you listen to UK politicians, the NHS is one of the business strategy they are using to boost their political ambition in the UK. Nurses can be positioned as stakeholders in the global health industry. Slide 10, please. So definitely, global health matters to every nurse everywhere. Therefore, in thinking about nursing today and tomorrow, this is very important. In thinking about nursing today and tomorrow, we must all look beyond our backyards. Our backyard is you practicing as a nurse in the hospital. I'm not saying there's anything wrong with practicing as a nurse in the hospital, but you must understand how what happens in distant places, such as Wuhan, China, can affect the health and healthcare of our communities globally. Healthcare is very important. Health outcome in Zimbabwe, health outcomes in Nigeria, health outcomes in China can determine how the economy in the UK, in so many other parts of the world, is being influenced because of one fact: migration, which is one thing that drives global economy. So nurses have the professional obligations to understand the world in its broader context. It begins with understanding the policies and the politics of globalization. What is the politics of globalization? We must understand that policies that must affect health are always health policies. We must understand that the global community responds to policies that makes the global community healthy. Once you've understood that, it will help you to develop yourself as a nurse. Now, next slide, please. Now, what are the nursing challenges in providing effective leadership in the global health industry? Now, we've talked about your positioning. We've talked about how you can position yourself. If you've missed anything in the last sections I've been talking about, one thing you should not miss is to position yourself as a leader in the global health industry starts with you solving a community problem. How can you identify a community problem? Go back to the 17 SDGs. Pick up your own target, start working on it locally. While working on it locally, amplify the impact of your work, and you will grow from there. So now let's talk about nursing challenges in improving effective leadership in the global health industry. Now, nursing is seriously, I want to stress it, nursing is seriously underrepresented in major global health space. Now, I wouldn't want to be that person who says others are getting it better than we are in the nursing space, but truth be told, others are actually getting it a little bit better than we are because we are underrepresented in major global health space. This has a negative impact on global health as well as nursing practice. Being underrepresented as members of the nursing workforce have a negative impact to the global health space and also the nursing profession. Now, if you're a mentee graduating and so many other persons who will be joining on live, who will be watching the replay, and you are a nurse or you intend joining the nursing workforce, think about strategies on how to increase your representation, your advocacy towards bringing better solutions to the global health space and the profession. Now, the lack of a strong global nursing voice is one manifestation of this, alongside the lack of strong voices from low and middle income countries, indigenous peoples, and young people like us. Now, I mentioned that we are underrepresented, and I mentioned the cause. That the cause is as a result of strong global nursing voice not being available, strictly available, as well as the lack of strong voices from low and middle income countries, indigenous peoples, and young people like us. We need every professional nurse to stand up to this call and increase on our representation. Now, this representation starts from one, the clinical setting, educational institutions, community health agencies, politics, and other aspects of contemporary societies. This is how we can begin to dominate global economies. Now, you've gone from that point where you've realized that as a nurse, you need to function as a community leader, as a change agent, as an ambassador, as a board member of different health institutions. You've grown from that point, right? Now we are in the point where we are saying that we need every professional nurse to stand up to the call and increase our representations in each of these aspects I've mentioned, from the clinical settings to the educational institutions, from the educational institutions to community health agencies. We need effective leadership in these different aspects. We need effective leadership in politics. We need effective leadership in aspects of contemporary society. Contemporary society might just be you being well represented when it comes to the social space. All right. So this is how we can begin to dominate global economies. We should, why should nurses consider active participation in global health as a means of an end for our professional growth? Now, remember, global health is not another medical field distinct from nursing. Most persons, after their nursing degree, they'll say, okay, I want to go and study global health. But one thing you should understand is that global health is not distinct from nursing. Global health is part of nursing. Global health is part of the global economy. All right. Global health is one of the strategies nations use to remain politically relevant, and is targeted at strengthening various system when it comes to these nations. So it is very, very much important that nurses play major roles in the global health sector. And how can we do that? Next slide, please. We can do this through strategies such as building our influence. Now, we should know that governance is a means to changing societies through public policy. The health sector is one of the most relevant parts of governance. So if you can grow your influence outside the clinical setting, outside the educational setting, be a community leader, what you're actually doing as a nurse is that you are increasing your influence. Now, look at every nurse who is a role model to you. Look at every nurse who is impacting on his or her society, on the profession. What they've done is that they've gone from that point where they are irrelevant to increasing their influence. Once you increase your influence, listen to the next thing that happens, or the next thing you should focus on is your platform growth. The nursing workforce is a diverse community. All right. Several leadership platforms can be strengthened around the profession. Nursing is a very diverse profession. You have people in nursing who can do so many things in the communities that would be recognized in the global health space. That is you growing your platform. Then the next reason why we should consider building our influence, platform growth, is to be visible. Visibility. Nurses are the center of healthcare decision making. Once you hit the hospital, the first set of persons you would meet in their numbers, I mentioned earlier that nurses are the largest healthcare workforce. So visibility is one thing that is important for nursing, not just being visible in a negative aspect, but strategically positioning yourself for leadership to be visible in positive light. All right. So nurses are the center of health decision making and should be more intentional about showing up. Now, the sweet part is once you've grown your influence, once you've grown your platform, once you are visible, you can create wealth. All right. Global health is a key component that drives the most global economies, as explained earlier. This wealth can also be created beyond the bedside, beyond the clinical setting. It can be created into your pocket. So don't think, okay, because you're positioning yourself for leadership, you're just there solving solutions. You cannot solving problems. You cannot really meet your own immediate needs. No, as a nurse, you should be at that point, or you should position yourself at that place where you can easily create wealth, because your profession has a relevant place in the global economy. Next slide, please. Now, how can nurses build a formidable platform? How can nurses build a formidable platform? The first thing you should do, I've mentioned that you should think of yourself as a board member, a community leader, think of the SDGs, start working locally and all that. But how can you build that formidable platform? It starts by you doing one thing. The thing I did in 2016 with my organization, when I started my organization, 360-degree Health Network, I left the city of Port Harcourt. I went to a village, a community in Delta State, because I said to myself, this organization is something that would impact the health of communities. I cannot impact the health of communities from Port Harcourt All right. So I had to move closer to the community, which is what I started with the idea of thinking globally and acting locally. Think globally, act locally. Thinking globally is you being aware of the sustainable development goals of the United Nations. Thinking globally is you being aware of the initiatives of World Health Organization. Then you acting locally is meeting the needs of different communities when it comes to the problems you are solving. Now, think globally, act locally was a mantra by a Scottish planner and conservationist, Patrick Gates. Now, the idea of this conservationist is that uh, he said that in climate action that we should try as much as possible to play our own part in our different environments. So nurses should also get involved in community practice in their own setting, deliver healthcare initiatives in their own setting, and see how to impact or provide solutions that they can step up when it comes to the global health setting. So one thing you should do for yourself is to think globally, act locally. If you think of the WHO, you become more interested in working as a healthcare worker, because the WHO, one thing they do is that, just like I mentioned earlier, if they have uh disease breakouts in Uganda, Guinea, China, what they do is they work with healthcare workers who are there locally. They are trying to provide global solutions. The global solution is, how can we prevent this disease from becoming prevalent in this locality and becoming an a breakout to other communities. So they work with healthcare professionals in that locality to see how they would prevent this disease condition from spreading. So provide locally relevant solutions. All right. Now, another thing you need to do is, the second thing you need to do after thinking globally and acting locally is to define your area of expertise. What are the areas you are so much an expert in? Now, expertise, as we all know, can be gotten through mastery, which is something you do repeatedly. Outside that, you can develop your expertise through what I call gig. Gig, the G there is you can be a genius, such as, let me say, C. Ronaldo, Messi. These guys are genius when it comes to football. When it comes to writing in the Nigerian space, Wole Soyinka is a genius. So you can be a genius actually in anything you're doing, and through it you can become an expert. But let's say you're not a genius. Let's say you're not that intelligent. You're not like Thomas Edison. How can you still become an expert? You can become an expert through experience. Most times they will say experience is the best teacher, though I don't believe in that. If you have a bad experience, you become a bad teacher. Okay, so become experienced anyway in the positive direction. Years of experience, results oriented, through trial and error, and persistency are one thing that most experts have used to break out. Now, let's say you're not a genius, let's say you're not experienced, you still have an opportunity to become an expert. And how can you do that? You can do that through educational qualifications. Most nurses back home Africa, we have so many educational routes to becoming nurses. Some persons is just your RON, some persons they have the BSc, some persons they have the masters. Don't allow the ideology in your community to limit you from how far you can go. You can get an education in what is it called? Autism. Education of people with autism. You can get just that education, and you will be the next expert that will be called on CNN to talk about people with autism. Because when it comes to this niche, we don't have so many persons going into these niches. They will look for anybody who is available to come represent people with autism and all that. So don't limit yourself. Say, okay, I've studied nursing. The next thing is to go and do. The next thing is, okay, let me just work in the clinical setting with my RON. I don't need a master's. I don't need a BSc. I don't need a PhD. No, be open to learning. Open to continuous learning. If you have the means, the financial capability, take up more degrees, take up more certifications, take up more licenses. You may not know when you will need it as an expert. Okay, let me quickly go through. I'm almost done.
Yeah.
The next thing for K is be knowledgeable. When it comes to you becoming an expert, you have to have a good wealth of knowledge. Slide 14. The next thing is to seek for opportunities and get involved. When you see an opportunity online, when you see an opportunity, people talking about opportunities, put your best foot forward and apply. Get involved into networking, get into different communities that are progressive, register for the North Mentorship Academy. These are networks that would allow you to get involved. All right. So slide 15. Let's go to slide 15. Let me just round up. Now,
Yeah.
lastly, I will talk about the two most critical challenges holding African nurses back from going global, holding African nurses back from being leaders in the global health economy or in the global health industry. The first thing is personal factors such as inferiority complex, low self-esteem, lack of an impact background or work history outside just being another nurse. The next thing is general factors such as their educational background. I've mentioned it. Try to expand on your horizon, learn more, be open to more certifications and all that. The lack of mentorship and guidance, which is what the Nurse Mentorship Academy is providing to us today. Now, what are the two most important things they need to do to overcome these challenges? Adapt to the culture of thinking global, get the needed skills, and also look forward to getting mentors and role model in the nursing space. Now, nurses can fit in as role models of many other younger nurses, but our journey is all different. How can you be a role model? How can you be a mentor to other nurses? It's through engaging in programs like this, through developing yourself. I've mentioned about you being an expert. I won't be here today if I'm not providing detailed solutions to problems that people have seen me as an expert in my niche and in the nursing profession. So once you can position yourself, which is the intent of this section, once you can position yourself as a leader in the global health industry, people would start seeking out for you. People will start, then go they rush you. Let me use that local adage. They will be rushing you to become role models. People will be looking up to you as mentors. All right. So I would want us, this is my last call now, to launch out, think of how to provide solutions, detailed solutions. It can be you just providing community service, cleaning an environment. Don't say I'm a nurse, I'm not to go to that aspect. It can be you just cleaning a space. It can be you just helping out in a community service, Rotary Club, and so many other things, Red Cross Society you can do to add to your representation in the community. And at the end of the day, you will see yourself growing from there. Now, this slide will be shared to us, though I don't intend to, but as a last call, this slide will be shared to us because I had to rush through the last section. It will be shared to us. Please, once you get a copy, don't share it outside the space of it being given to you, because it's something that I can turn to a book tomorrow. It's something that I can turn to an intellectual property. So it is a privilege if you're getting it. Thank you. This is Obina Victor Eze. Until I come your way next time, I will be expecting questions, or we'll move over to the next section. Thank you for listening.
Thank you so much, Mr. Albina. Thank you. Thank you.
Wow, awesome.
I
Thank
expect
you.
a round of applause. I'm clapping. I want to see clap, like round of applause even in the comment section. This is boom. Like boom.
This is a master class, more than a master class. What paying dollars and dollars of, I mean,
Are you sure we are in graduation?
thousands
Are
of
you sure we
dollars
are in graduation?
at all this time. Thank you
All
so
right.
much, Victor. Yeah.